Hello and welcome to the Weaponized Body podcast. I'm your host, Dr. Ryan Hewitt, and today I'm going to touch on a topic that is near and dear to my heart. It is where I would say shine the most in my expertise and knowledge and understanding of the human body, and that is talking to people about the benefits of chiropractic care. Now, stick with me. Even if you have never been to a chiropractor, you're not really interested in knowing about chiropractic, I would say just, have a listen and maybe I'll be able to help open up some understanding of what chiropractic care really offers today's world. Because I think that there are some stigmas about chiropractic that we have to bring to the forefront first and talk to people about what most people are using chiropractors for. And that's basically like as a 911 service. I'd say the majority of people you talk to have been to chiropractors usually only go to chiropractors when they are injured, when they have a symptom and when they hurt. So we're going to talk about why that's not the best use of chiropractic in today's world. It is obviously one of the benefits of chiropractic that there are some pain relief benefits of getting of chiropractic and getting adjusted. Um, but the stigma of chiropractic really started back when chiropractic entered the world of insurance reimbursement. And when do you use your insurance? Well, it's when you're broken. It's just like car insurance. You only need the insurance policy when you crash your car, when you've been in an accident, when there's, an emergency. So your health insurance functions in the same manner. Despite what we may think insurance is really for getting you out of pain, period. And insurance models have created this idea that you get a certain amount of chiropractic visits and everybody's the same and you get a cookie cutter plan of whatever your reimbursement policy allows you to get. And the assumption is like, oh, well, that's all the care I need. Even though your insurance company doesn't give a rat's ass about you, they don't know anything about you, they don't know anything about your injury, but they decide how many visits you should get, what type of services you are able to attain, and what are the copays for that. When I started my office back in 2010, and even prior to that, when I was interning, I knew that the future of chiropractic and the future of health did not lie in the hands of insurance companies and health maintenance organizations. I've always believed strongly if you are leaving your health up to somebody else or another organization to keep you healthy, you're in big trouble. All right. The only people that know about what you need is you. The people that are the healthiest people on the planet, they take ownership and responsibility for their health. And yes, they dedicate time, they dedicate energy, they dedicate money to being a healthy person, particularly in today's world, 21st century, in our modernized society. There are things that we need to do and invest in order to have optimal health and function. And what I'm saying is that most people's MO is they wait till they break before they seek help. But if you're serious about building performance, health, recovery, and a resilient body that won't break, there is a different approach required. And I contend that you need a health team. Um, Anyone who's listening to this podcast right now, I would ask you, do you have, let's say, a dentist? And I guarantee you there isn't one single listener who lives in the United States or Canada or in the Western world, for that matter, who does not have a dentist. And it would be weird if you didn't. Either that or you'd be like, someone who's broke out of college and just, hasn't been to the dentist in a while. But I believe that most people understand the value of having a dentist on your health team. A dentist that you go for routine checkups, not just when you have tooth pain. And I think part of this health team, whether it's you hire a nutrition or training advisor, you have potentially a medical doctor or a concierge physician. You have other, players like yoga instructors, Pilates instructors. Let's say it's, a functional medicine doctor. I think one of the most overlooked yet essential players on that team is a great chiropractor. So today, what I'm going to do is I'm going to tell you about why chiropractic care, especially the type of care that we deliver in my office at Innate Wellness Center, is not just helpful, but essential for anyone who wants to build high performance body and mind. And why that type of concierge chiropractic service is the future of healthcare. And if you listen to anyone else who's in the longevity game, anyone else who is talking about optimizing your health, performance, recovery, etc., you're going to hear them talk about a third tier of healthcare. Peter Tia calls this, I believe, healthcare 3.0. This is what I term promotional health. So there's treatment of disease, there's prevention of disease, and then there's promotion of health. I like to practice the latter, which is promotion of health. And yes, it's true. A lot of people that come to my office in the beginning, they're coming because they either have a crisis or they're broken in some way or they're looking for help. But my goal, whenever I meet with someone, is of course to help them, you know, battle through and get through this particular problem as naturally and as from a conservative standpoint as possible, but also try to set the stage to create a larger vision for their potential than perhaps they even envision for themselves. So try to show people what they could have, in the beginning while giving them what they want. So let's talk about my first point when it comes to why everyone should have a chiropractor in their health team. I believe that you need a chiropractor on your health team to be your first call when you are injured or have some sort of pain. All right. And that would be more like the check engine light going on. Okay. Not necessarily when you have a car accident or when you have a severe crash or fall. We're not talking about just solely acute traumas, but even more minor issues. I sat at the desk for 3 days straight for a marathon project or for a seminar, or I traveled to Australia and my back is kind of messed up. I have neck pain. I slept on it funny, whatever. I think the average person has these types of symptoms and they treat it with meds or they just ignore it. And if they are participating in the broken system, if they're going to see somebody, let's say they have a more significant injury, let's say they twist their knee playing soccer, right? That you're going to go to urgent care or your primary care. And then what's going to happen is they'll take a look at it and you're going to be visiting somebody who doesn't routinely, assess and, deliver recommendations for necessarily orthopedic issues. You're going to get recommendations for potentially imaging, or you're going to go, down the line of, physical therapy, which physical therapists are, definitely in line with this type of service I'm talking about, where we're more qualified practitioners that are assessing the physical body, right? So orthopedically, joints, tissues, muscles, movement, etc. Um, but when you have a more significant issue and you're looking for imaging, and you're going through, the whole process of like, oh, I'm waiting for my insurance to approve my image. And then I have an orthopedic appointment, a month and a half from now. In a lot of cases, I have saved many, many, many of my patients time, money, and hassle. Okay. Number one, when their injuries are not what they thought that they were. For example, I just had a patient, long-standing patient of mine whose son, who is 17 years old, he was in martial arts class, and he went for a high kick, and he had extreme pain. Well, he had minor pain at first in his hip, sort of like rear hip area, SI joint area. And then it developed into a more severe type of pain later in the class. And by the evening, he was in so much pain, he was in tears and they were panicking. And this was on a weekend, and they went to the walk in clinic and they were told, oh, you have a pulled muscle. You need to go to your primary. So they were about to go to their primary. And then from there, they would have, got an x-rays and maybe sent down that whole line of, the insurance protocols. But I said, hey, listen, bring him in. I'm happy to have a look at him. And sure enough, I have a look at him And the pain that's going into his SI joint is coming from his lumbar spine, his lower back. Okay. It was not a pulled muscle, right? He injured a joint in his lower spine that was causing nerve irritation from the fifth lumbar, which is where your sciatic nerve comes from. It was radiating into his SI joint and slightly into the top of the glute. Lo and behold, I had him in for 3 adjustments, and he's 90% better already. Saved them a whole hassle of mess of going to different practitioners and getting different types of imaging and spending money and time and hassle. And this is because one of my main jobs as a primary healthcare practitioner for my routine clients is that I am there to help, be that first line of defense, be that triage doctor to help them as conservatively, as time efficiently, and as cost effectively as possible. So instead of heading into the broken system, you have this trusted advisor that can give you an accurate assessment of, hey, is this thing really serious? Do I need to go to the hospital? Do I need to go get some imaging? Do you need to refer me for an MRI? Or can we manage this conservatively? Can you give me recommendations where I can handle this problem, within X amount of time and have this type of expectation? So if you're going to a practitioner, a chiropractor who has those types of skill sets, and I would hope most chiropractors do, they can, help you navigate the broken mess of this healthcare system. And that's why I offer this concierge service where I'm seeing people on a routine basis because I know them very well. I know what their baseline is. I have imaging in my office, so we have all of these tools and understandings of how to help people and how to like skip through all this red tape and disaster that the healthcare system is and save them time and money. So a great chiropractor, especially one trained in musculoskeletal neurological systems, is far better equipped to assess and manage most injuries from the source. Okay. So we're talking precision diagnostics, movement assessments, palpatory skills. I have a digital x-ray unit in my office, etc. I'm in my office. I even have more advanced diagnostics. I have, comprehensive blood work services. We have a soft wave device, which is a tissue regenerative technology that can help speed up musculoskeletal and tissue injuries. We have all these tools to help people from the standpoint of assisting your body's ability to heal itself. So that's my first point, and one that I lean on heavily and really try to communicate to all my patients, especially as an ongoing service, as a concierge chiropractic service. One thing that is a huge value add is that I am your first line of defense, for those types of musculoskeletal and injury issues. I'll have somebody come in for an extra adjustment if they have a minor tweak or something. We can catch it early and we can take care of issues. So the second thing that I want people to know about chiropractic and why it's valuable to have a chiropractor on your health team is that if you're seeing a chiropractor routinely, as I do in my model of health for my patients, is that I know my patients better than any other primary care professional in their life. I know them so well that I know what their baseline is. I know what normal is for them. I know what we're working on. I know what their routine patterns are. I know what they do for work. I know who is in their family and their stress levels, what they do for an occupation, what they do is for hobbies, what kind of things that we are working on from a standpoint of their health performance recovery, etc. So like their stressors and their movement patterns and their postures. So I'm very in tune with all of my patients that I take care of as far as what we're working on, what's normal for them, and what I need to do to help them tune back into their potential. So this is noticing like subtle imbalances on routine visits. I do an assessment on every one of my visits, which include, obviously there's a discussion, there's palpation, there's strength and flexibility testing, and there's a lot of intuitive understanding of where they're at, what we're working on. So And this is on a routine, ongoing basis. Some people I see weekly, some people I see bi-monthly, some people I see monthly. It really depends on who they are and what type of care they need. Everyone has different injury histories and occupations and hobbies and lifestyles. So I hate the word like crack. I don't just crack people's backs. That's not what, people come to see me for. So I'm helping people track patterns, coaching them on their physical, chemical, emotional stressors, and help them as much as possible get to the root cause of any of their ailments and really keep them on the top of their game. So number 3 is that I strongly believe and have observed over 15 years in practice that chiropractic is uniquely suited to neutralize a lot of the physical stressors of today's crazy modernized life. I talk about this often, how we've engineered activity out of our life, how we have baseline stress levels that are unnatural and higher than ever before. And those manifest in physical symptoms. One thing that I never thought, or I never gave, I guess, the respect to, especially as a new practitioner, is how much mental and emotional stressors can manifest as physical ailments. This is a really big thing. Uh, the Body Keeps the Score is one of those books that really speaks to this really well. I think it goes a little overboard saying like all causes of pain are emotional, which isn't true, but I think it's a huge underrated reason that people have physical pain. And it's not that I'm, correcting the cause of everybody's, emotional pains, but it is part of it to help people mitigate the problem, speak to them about those stressors, give them actionable strategies to help mitigate the stressors of their life. Let's face it, we sit too much. We're hunched over screens. We get into car accidents. We lift heavy with bad form because we think we're doing ourselves a favor by exercising. And that stress compounds along with the chemical and mental emotional stressors, not just physically in our joints and our tissues, but also neurologically. So, this is where I believe chiropractic shines by detecting and correcting what are called subluxations. All right. This is a word that people have confused and conflated. Subluxation is simply a movement disorder in the spine, it's a movement deficiency. So we have 24 bones in our spine, and each of those bones have, a series of joints. So you have your joint, you have a spine that is loaded with joints, and those joints have receptors in each and every one that give feedback to your brain, which is super cool. It actually acts as sort of like a, a like eyeballs in your body. In other words, your spine really helps tell your brain where you are in space. It's essential for healthy to have a spine that moves correctly and that is stimulated properly. It's essentially for optimal mechanics when you're exercising, optimal posture, as well as things like feedback to your brain that give you energy, that give you alertness, that give you confidence, that help you adapt, that help you heal. So to make this very simple, when you're getting good feedback from your spine to your brain, okay, and vice versa from your brain back to your body, you are regulating normal functions that lend themselves to what's called parasympathetic activity, which brings you more to homeostasis. And that is to say that when you're getting proper stimulus in your spine and you're moving well and you're practicing healthy posture, that gives your body the ability to stay at ease. And when you're at ease, you're far more able to adapt to stress. When you are unable to adapt to stress, you get stuck in more fight or flight or sympathetic. So chiropractic really helps take you out of those sympathetic stressors or helps you adapt to the sympathetic stressors better. And it helps push your body back to homeostasis, which is like baseline rest, repair, digest, reproduce. Okay. Stay chill. So we're not talking about treatment of pain always. We're talking about helping people adapt by helping their body move well. The fourth reason that I believe everybody should have a chiropractor on their health team is that is the safest form of healthcare in the world. This part might shock a lot of people. Uh, I often, hear people talk about or they see headlines where someone's been injured by a chiropractor. There's people that have had discussions about chiropractic and cervical, what are called manipulations, okay, adjusting people's neck and the dangers of that. And I've studied those. I've studied all of those dangers. I've looked at the research papers. And the truth is, it is very, very, very rare that somebody has an adverse effect or adverse response from a chiropractic adjustment, especially if the chiropractor is skilled, if the chiropractor has done due diligence, which we pride ourselves, very, very much so as far as making sure we're ruling out all red flags. We take x-rays on all of our patients we adjust. And we make sure that there's safe, effective, and corrective forces being applied to people's bodies. Okay, these adjustments are done in a very specific manner. Okay, very skilled manner. We are always studying and practicing and making sure we're delivering the highest quality of care. And I hope that all chiropractors are doing this. Okay, and when I say chiropractic is the safest form of healthcare in the world, the proof is in who ensures my ability to practice this craft called chiropractic. My malpractice insurance I pay is similar to the car insurance I pay, even less. So it's very minimal cost because the amount of you know claims against chiropractors is so small because the art of chiropractic is so safe. I we're not using needles, we're not using scalpels, we're not giving people drugs. Right? We're restoring movement, function, and health and proper neurological function. Low risk, high reward. This is why it's the most powerful first line of defense, for any non-emergency health issue. And really, the skill is in determining whether this is something that is an emergency issue that needs prompt medical care. That's what it's for. In many cases, emergency medicine. We have some of the most talented, best emergency medical services in the entire world in the United States here. However, with chronic disease, with chronic health issues, with chronic pain, we have a horrible healthcare system at treating these things because they are treating them with the same emergency services, such as drugs and surgery and needles and injections and other modalities that are not as safe. These practitioners have very, very high claims. They have very high malpractice insurance. Chiropractors, not so much, because what we do is safe, what we do is effective, and what we do is valuable. Now, the last point I'm going to touch on, which is my fifth point of why everyone should have a chiropractor in their health team, is that I believe that the type of chiropractic that I'm mostly speaking about here, which isn't just treatment of pain, it's not just the treatment model, it is the future of high performance care, high performers, and high performance healthcare. The model I use in my office, we don't just have people come in only when they hurt. At first, I am treating a lot of people that are trying to solve a physical problem. But after the fact, I always encourage people to make sure we're maintaining the benefits they've invested in and also use my services as a primary care chiropractor and somebody who has a concierge chiropractic service to keep an eye on them and make sure we're cleaning up any issues that could otherwise accumulate and cause more future issues. So try to help prevent setbacks. Um, Always be observant of what's happening with their physiology, and practice that third tier health promotion, that third tier of healthcare. Chiropractic is uniquely suited to deliver this tier of healthcare. Especially, I like to brag about my office and my doctors and our services because we are very good at helping people get what they need, but also teaching them what they could have and having those tools to help them get what they could have with our functional blood chemistry. We've just invested in a decompression table for disc injuries. We have a tissue regenerative technology called SoftWave to help expedite healing by using the natural responses from the body, such as stem cells and angiogenesis, and which is the creation of new blood flow, and of course, corrective chiropractic services and corrective exercise. This is where our model, I believe, shines at Innate Wellness Center. There's plenty of other chiropractors that are practicing similar types of healthcare, which, by the way, is generally not something you would use insurance for. Something you'd use maybe um, your health savings account for. It's something you would use, you know, some of your savings for, or you're investing, some of your monthly income in, because you are getting a significant return on your investment. It's like health assurance rather than health insurance. And, for myself, I have a program called the Weaponized Body, where mostly I'm helping men with some of their exercise programming, their nutritional services. I do macro based uh, nutrition plans for men who are trying to either lean out or put on muscle. So I do have like a body comp analyzer called an InBody in my office. So there's all these things that I've you know moved into, that just give this unbelievable, I believe, unbelievable value for somebody who's just looking to, reach beyond what they think is possible. Better health overall, monitored with blood work and functional movement assessments, um, and in body composition scans, and helping them perform at their optimal ability by doing routine assessments to make sure they're improving, and improving their performance and optimizing their biomarkers. Also with weaponized wellness. So I help people optimize their hormones, dial in their supplements, things like that. So what I'm doing is I'm training people to live longer, be stronger, more flexible, mobile, and neurologically resilient, which is a lot of times done outside the insurance red tape. So private pay chiropractors like myself are in that unique position to deliver that third tier healthcare, which is, those integrated services, because, I'm not limited by, those uh, 7-minute appointment times with CPT and billing codes, and, limited amount of visits with a copay. What I'm doing is I'm doing a, an, a, s- a comprehensive and diagnostic initial assessment, getting actual facts and data, and making a plan suited and customized to the patient in order to help them improve. And then remeasuring. Okay. And we're always remeasuring, always aiming for better. Okay. Insurance does not pay for that. They don't pay for better. They just pay for, you know, mitigate or get out of pain. So, in closing, if you care about performance, recovery, you care about building a body and a nervous system that's resilient, not just for like today, but for the next 30, 40, 50 years, right? Don't wait for pain in order to go see your concierge chiropractor, right? Don't wait for like a diagnosis. Don't wait for the system to fix you. Never wait for the system to fix you. Take charge and ownership. Build a health team, okay? Like your life depends on it, because it does, for yourself and your family. All right. Get a chiropractor you trust. You can always reach out to me, direct message me. I've helped many, many of my patients find great chiropractors all over the world. I have a strong network of docs that practice similarly. I've had lots of patients that have moved out of Massachusetts for various reasons, who have moved all over the US, and I've helped them find chiropractors. There's lots of them out there that don't just crack your spine, and collect your copay, but they'll help you elevate your life. So you deserve care that sees you as, a person that matters, not just like a symptom in a system. So let chiropractic help you show what that feels like, what that looks like. And as always, I appreciate everybody who listens, anybody who ever has any, feedback, commentary, questions, feel free to DM me. All my social media links are attached to this podcast. And as always, please like, share, rate, review. I appreciate you guys. I'll see you next week.